Good morning. We are quite pleased today to have three individuals who've undergone mesothelioma treatment here at the Brigham and Women's Hospital International Mesothelioma Program. I'm Dr. David Sugarbaker, Director of the International Mesothelioma Program here at the Brigham and Women's Hospital in Boston. We are always inspired when our patients can take the time to come back and talk to us about many different aspects of their care, and always inspire us to improve all aspects of our program, from the travel assistance program to the housing program, and of course, importantly, to the treatment program. So we are indeed very grateful to these three individuals for taking the time to travel here to Boston today to tell us a little bit about what life was like when they got their diagnosis, how things went during their treatment, what this experience has taught them, and therefore might help and inspire others. So we're very pleased to have Karen Grant, Dick Stark, and Sissy Hoffman here today. Very grateful to all of you for being here today. So maybe I could open it up and start with you, Dick. Do you want to tell us a little bit about what transpired when you found out about
Yeah, sure.
diagnosis?
Thank you for having us here, Dr. Sugarbaker. I was late 78 years old when my local doctor noticed that I had a sore spot in my rib cage, sent me to a surgeon, a thoracic surgeon in Bangor, and I live up on the coast of Maine, and this surgeon took a look at it, did a biopsy, and said, well, you have mesothelioma. And frankly, that's a disease that's too complicated for me to handle. But there are a group of surgeons at Brigham and Women's in Boston that have made a whole new thing out of treating this particular disease. He said, now, I can send you down there to see these surgeons. They may not take you. And I said, oh, really? Why not? And he said, well, after all, you are 79. When I arrived here in Boston and met Dr. Sugarbaker, he laughed and laughed, and he knows this crusty old Mainer pretty well, and said, of course we'll take you. Turned out that I was strong enough for the surgery, and within 6 months I came back to Boston and had the surgery done. I was fortunate in that I did not have to have the lung on that side of my chest removed.
Dick, let me ask you, what year was this, and what time of year?
This was April of 2008. I was a businessman most of my career, but for fun, I always was a musician. I played the French horn, the tenor saxophone, the clarinet, and what have you. And I needed that lung to continue to play because wind power is very important. And Dr. Sugarbaker agreed he'd leave me with the lung, which he did. Surgery went well. I was in the hospital for 17 days and then at a local hotel for a while, being nicely cared for. The doctor said, when you go back to Maine now, you must not touch the French horn for 6 months. And I said, yeah, I hear you. About 2 weeks later, I snuck it out of its case and started to play. And it didn't seem to hurt very much. And the next week, I played a little more. And pretty soon, about 5 months before they allowed me to play, I was playing full time.